If you've often wondered, how should I be marketing? Should I go broad? Should I be narrow? Well, I'm going to answer that question right now. Come back in just a second. Hi, I'm Ginger Bratzel from New Patient Attraction Automation and gingerbratzel.com, and I'm the author of the book Secrets to Creating a Prosperous Dental Practice. And I'm going to answer the question, should I be marketing broadly or should I be very specific and narrow? And my answer is actually both. They both have merit. So it's not, should I be marketing this way? I always start with, what's your intention? And my clients always laugh at me because that's why I always ask. They said, what should we do? And I said, what do you want to do? There is room for both things. So the benefits of marketing broadly is you are more diverse to more audience. Now, your offer is not broad. What you're saying, you're not listing every service you have, but you're going out to a broader audience, a targeting audience. So either it's through print media, it's online media, is it social media through Facebook advertising, you're going to be hitting a bigger crowd. But if you've done your research, as we've talked about in other trainings on these weekly e-zines and weekly video strategies, we talk about how to figure out what you specifically want. So if you go narrow, you're going to have several opportunities to be narrow because there's not one narrow way you should do it. So if somebody's suffering with loose fitting dentures, they have one thing they need. That's one audience. But if you're looking for someone who doesn't like their smile, that's probably another audience. Or if you have a family who's frustrated and they're trying to get everybody in and they have family issues, that's another audience. So each one of those audiences is different, so we are going narrow in 3 different ways. But whatever we do, our offer has to match what our audience wants. Our audience needs to match what we're offering, and then we need to be consistent on the follow-up on the other end. So if you're looking for new patients in general, you do broad, but you also need to be specific. And I tell my students, we'll talk about mixing that up. We're doing Facebook advertising, we'll actually test it. It's very easy to do that. We'll try a broader audience, and then at the same ad, we'll try a more narrow audience, and we'll see what our results are. And it's very affordable to do it in that way. That's why we talk about Facebook advertising, and that's why it's so effective as the best online advertising there is, even above Google SEO right now for dental practices. I would go to bat for Facebook all day, every day. So what you should be offering, what you should go after, and who you should be going after is dependent on your data. So it's not a simple answer, broad or narrow. You need to figure out what you're doing. And I take it and we do it on a whiteboard or piece of paper and we map it all out. And we ask all those questions. And if we start broad, we almost always follow one up to say, hey, we've resonated with a certain group from that research. Now let's dive in deeper to that one. We're going to go narrow there. So I hope that answers the question of going broad or narrow. If you haven't already been to our website and requested our free report, How to Get All the Patients You Need, it's over there at gingerbratzel.com. And if you have already downloaded that or requested our free CD, it's time to take the next step. Join us for a live training event and time to invest in your practice. Or if you're really serious about doing it faster and easier, it's time to join our mastermind program and our coaching program, where we specifically work on your practice and everything you need, all the little nuances. So until I hear from you, until next time, this is Ginger Bratzel. Take care.